But then ANF ended up not only helping me to get results in the first treatment, so that got buy-in from my clients, but then it also helped to just calm down a nervous system. I can already see with my eyes that they have more motion too. From there, usually the next day they'll text me when I, follow up with them, and they're like, I feel even better than I did yesterday. So it's pretty immediate to see results when I, get the right assessment.
Hello everyone, and welcome to the new ANF Academy interview. My name is Thea, and today I'm interviewing Sarah Leong Lopes. She is a doctor of physical therapy from United States, from California. Hi Sarah, welcome. Thank you for joining us.
Excited to be here. Thank you so much for this opportunity.
Before we start and dive into our topics, which will be shoulder pain, different types of pain that you treat now, can you tell us a little bit about yourself? Can you tell a bit about yourself, about your education? What do you treat? How your daily look? Because you're also a mobile therapist, right?
Yes, that's
how
right.
How your day looks like as a mobile therapist.
Yeah, absolutely. So first of all, I'm very, very well known to be someone who just always likes to learn. And I'm very, very curious about the human body and the way that it moves and it heals and whatnot. So ever since I was young, I've always kind of had this obsession with how do we get the body to be its best? And so that's what brought me into physical therapy in the first place. I went to school to get my clinical doctorate and, was practicing. And initially I had been in pediatrics working with kids. And then I started working in adult orthopedics and was realizing that there was kind of a gap in how I was able to get people, back to where they wanted to be, or, any sort of rehabilitation or just habilitation of, people like kids who maybe haven't been able to do certain things before and were learning it for the first time. And so typically, at first I was working in a clinic, and I was working for somebody else. And, we were losing people in like the middle of their progress because their insurance was running out and they couldn't come back for more visits, or because they just weren't seeing results as fast or as consistently as they wanted to. And so I started, asking the question, okay, what's missing? And that's when I started my mobile therapy practice. I started mobile therapy before I was practicing ANF. And yes, I was having a little bit more consistent improvement and consistent progress with the individuals that I was working with. But once again, it was slower going than I felt like could happen. And, people just were noticing that there was still something else missing. So I've done, a bunch of other training with manual work because I trust my hands. Ever since I was young, I've always been very, very good with my sense of touch. So I got into other manual therapy practices that helped me, develop the skills for, palpation and whatnot. And then once I got introduced to ANF therapy and learned about how much we do palpation and clinical surgery, as Dr. Mikkel puts it, it just completely just blew open any ceiling from healing and from performance with my clients in mobile therapy. And it has literally changed the game. I'm getting people better 2 to 3 times faster than I ever did in the clinic consistently, which is pretty incredible.
What are the most common limitations physical therapists face?
Yeah. So some of the most common ones that I've encountered and that a lot of my colleagues have encountered, a lot of it is patient or client compliance. So, we'll do the work with them in the clinic, and some of them are very active and they're participating and helping out. But then, the next visit they come in, they're like, oh, I forgot to do my homework, my exercises, or, this feels, exactly the same. And there seems to be lack of their understanding and their confidence in being able to carry out what they need to do at home. And then another one is, sometimes, as I've learned now, not just with the manual work, but also with ANF therapy, it's not a muscle and, joint tissue, local issue. It's referred pain. And sometimes we miss that as physical therapists because even though in school we talk about, the cardiovascular system and we mention that there's a lymphatic system and whatnot, the focus is primarily on muscles and movement and how those two specifically are paired together. So we end up missing a lot of the other layers that are influencing how we can move and how the body feels safe to move, even with all the tools that we have, learning for muscles and movement and strength and everything like that. Sometimes we just miss the other areas and other systems that are influencing what we can do. Nothing's ever truly isolated. And that seems to be a limitation with getting the range of motion, getting the strength, getting the, clients to be able to get back to their activities, whether it's just daily life or something a lot more involved. Like I work a lot with pickleballers and, higher level manual labor type of individuals.
You mentioned compliance. Is it because they're in pain? So when they're in the clinic, it's much easier because they're pushed to do the exercises. And then when they go home, pain prevents them from continuing, I guess.
Yeah, absolutely. Pain seems to be a big fear for a lot of people. They're like, oh, if I feel pain, then, I'm making things even worse. I'm doing even more damage. And they don't quite understand what is safe. And sometimes there are some people who think oh, no pain, no gain. I have to push into the pain really, really hard to make it better. And then they come back much, much worse because
But what is the right recipe? What is it to avoid? Sometimes you have to do the exercise that your PT prescribes. Yeah. But when you said no pain, no gain, is it good to avoid exercise when there is a lot of inflammation?
Yeah. What I normally tell to my clients is, I go by what I call a 2-point intensity rule. So whatever your baseline is, if you have no pain, I don't want your pain or your discomfort to go up more than 2, maximum 3 points on that pain scale or intensity scale, because then that helps your nervous system know you're not blowing past any boundaries or warning signs. And so the same applies. If you're at a 3 out of 10 pain, I don't want you ramping up past a 5 out of 10, because then your body's going to be really, really, alarmed, right? Mm-hmm. And then, so in that way, I'm kind of teaching him, it's more of an awareness, just dialogue with your body, as opposed to fully avoiding pain, but then also knowing that you're not going to push past that much.
Are there any specific conditions it was challenging for you to treat before you enrolled in ANF education?
Yes. A big one that I had noticed was shoulder pain. I actually see a lot of people for shoulder pain. That seems to be the majority of who I see at the moment. And, there's a lot of other connections into the shoulder than just the tendons, right? We have a lot of knowledge about how the liver can affect the right shoulder and your stomach can affect the left shoulder, as well as there's a lot of connections into the neck and the nervous system and the blood that runs from the heart, runs from the neck into the shoulders and the arms, right? And so, just from a basic PT standpoint, we learn to mobilize the joint and stretch out the muscles and strengthen the muscles, and make sure that we're treating the neck and the shoulder at the same time, because their muscles are connected, right? But then the ANF ended up not only helping me to get results in the first treatment, so that got buy-in from my clients, but then it also helped to just calm down a nervous system, because a lot of people, when they feel pain and discomfort in their shoulders and their neck, it feels so vulnerable because our body already knows there's a lot to protect here. And then it's also very stressful because we use our arms a lot when we're doing any sort of motion. So to feel that sort of discomfort, or even to the extent of debilitating pain, the shoulder is such an important joint for a lot of the motions that we do, the activities that we do. And so ANF has been, really helpful to get relief immediately. I can tell right away if I'm attacking the source or I'm getting to the source of the issue. And then the clients get buy-in. They're like, oh my goodness, this is amazing. This is the first relief I've had in, months or years. And then I also know that we're optimizing, the body's ability to just, regulate the oscillations again. And I know it's a deeper healing, deeper recovery than just me, teaching them some stretching and strengthening.
But you said you get the results already within the first treatment. What does it mean? You managed to reduce their pain or to improve the range of motion? I mean, I know it depends on a patient and on the body condition and on the issue itself. But is that it? The pain reduction and range of motion improvement?
Yeah. So typically when I see someone for the first time and I do my manual assessment and, I check range of motion and strength and, pain levels and whatnot, after I put the discs on, a lot of them will notice, oh, wow, I just feel a reduction in pain. The average that people will tell me is anywhere between 40 to 60%, which is like a lot, right?
Yeah, it's a lot.
I'll be
yes.
like, wow, I feel like quite a significant reduction in my pain. And then with that, they start to like move their arm around curiously, and they're like, oh, this feels good. And even before I take out my, goniometer to measure, I can already see with my eyes that they have more motion too. And then from there, usually the next day they'll text me when I, follow up with them, and they're like, I feel even better than I did yesterday. So it's pretty immediate to see results when I, get the right assessment, and then I can hone in on the right tissues that are looking for help.
But what it would be without ANF? If you had all
goodness.
these patients before you enrolled in ANF education, how that would look like? How much time would you need to help them? And would you get the same results?
Yeah. So I actually so I work in my mobile practice, but then I also work a couple days a week at a regular clinic, again in person, where, so my mobile clinic is all cash pay. And then the clinic I work at is involved with insurance. And I actually had two similar shoulder patients come in at the same time. Both of them were presenting with a tendonitis issue, as well as just like repetitive overuse. They were both very, active. So they were using their arms a lot. And I compared the timeline between the two of them using what I had access to in my mobile clinic, including ANF, and then what I had access to in the insurance-based clinic, which was like, shockwave therapy and taping and TENS units and hot cold packs and all that stuff. And I actually got the ANF client better 2 times faster than the client the patient that I had in the clinic. Yeah.
That's quite impressive.
It's a big difference for people who are very, very active and are trying to get back to, their high level activities.
And one of the reasons I started doing these interviews featuring therapists that use ANF is to increase the awareness around ANF, because for professionals like you, it's challenging to believe that something that small can make actually a major difference. When I start explaining, it's not just applying a sticker, there is a whole science behind. You have to know the combinations, you have to check the patient's body to know. So it's quite different to show them this is the influence of the devices. This is what kind of results you can actually get, and much faster. So it's nice to hear these kind of examples, especially you said you had 2 similar injuries, but yeah, that's quite impressive.
I saw this one individual who had back pain, and he had actually been dealing with back pain for like 2 to 3 years, and it was like radiating and getting numbness and tingling down his left leg. And he'd tried physical therapy before. He tried it a couple times, actually. He tried an online program to try to address his back pain, all this sort of stuff. And then the first time that, I just went through my clinical surgery, manual palpation, I set up the first protocol, and I just, had him laying there because he was skeptical, of course. He's like, I don't think this is going to work. And I just had him laying there. And as I was explaining to him, okay, so with these discs on, this is what you need to do for the next 72 hours, drink water, He interrupts me. He's like, I don't know if this is just like me getting in my head or whatever, but my tingling in my foot is gone. And it had only been like the 2-3 minutes of me explaining the education to him. And he's like, but it can't work that fast, right? And I was like, yes, it can. It really can. So he was like, this isn't supposed to work. And I was like, well, he's like, is it a placebo effect? I'm like, well, placebo is if you believe it's going to work and then it works, but you didn't believe it's going to work and it worked. So that's something, totally different. And then the next day, he texted me. He's like, I still don't have any tingling. My back is feeling much better. So I just kept following up with him for, I think we did like 10 weeks together, and his back pain resolved. He was back to playing pickleball within 2 weeks, because we were doing the training. And he hasn't, complained about it to me since. So,
what was the root cause? What was the root cause? Do you remember?
Yeah. So his diagnosis was a pinched nerve, right? And
quite common.
Yeah, it's
when you do
common.
MRI or when you do a scan.
Mm-hmm. Right. But it was kind of a combination of, he had not a lot of just good support for the muscles through his trunk. And as soon as we got the discs on there to help, release the tension on the spine and re-engage and re-optimize the abdominal muscles, the pelvic floor muscles, and just kind of get everything back to, just coordinating well and being able to maintain that, that's why he felt so much better, so much faster to play pickleball with the ANF. It took off the excess stress that was going on. And then, he was able to actually notice I feel more stable. And that was the end of it for him to, get out of the pain for good.
Is it possible that due to lots of stress and emotions, we get some kind of pain in the body without injuring ourselves?
Oh, yeah. I actually have seen quite a few people who, they come to me with unexplained pain. They're like, this came out of nowhere. I have no idea what happened. There wasn't an injury associated with it. I didn't do anything. It's just coming out of nowhere. And for those individuals, we're usually able to trace it into some sort of emotional component that the body has stored in the tissues, and it is now referred pain. And sometimes just by bringing that awareness and them kind of being like, oh, I did have this, for example, there's someone before ANF that I had worked with who had hip pain, and we tried everything we needed to do from the traditional physical therapy standpoint to get it better, and her pain just kept coming back. But then it came to a point where she came back to me and she's like, hey, Sarah, my hip pain is better, and it's because this issue that I was having with a relative of mine is not an issue anymore. And now that hip pain is gone. And I was like, okay, cool. So now I'm only imagining how much faster I could have gotten her better instead of rehashing the same thing for weeks and weeks and weeks if I had ANF discs to help address the emotional component instead of what my training at the time had been, which was just muscles and bones and ligaments and joints.
Is there any specific case that when you used ANF therapy on that patient, you were you were shocked with the result you got?
Yeah. Oh my goodness. There was this. It was on me. It was the first time that I was trying out physical therapy and ANF. I had the knowledge for both. So basically, I had fallen down a set of stairs, and I got pretty bad whiplash in my neck from falling down these stairs. And I couldn't turn my head more than 5 degrees each way without it just hurting. And I'd been in a car accident before, so I was familiar with this sensation. But this time I now had ANF, and I had learned under Santi, who's one of your instructors, right? And now he and I are very, very close and in touch. And I had him help me learn how to set up a protocol for myself for it. And I remember being so shocked at how fast my pain decreased. I was able to turn my head again. And it only took me that, for me, because I'm, young and healthy and active, it only took me that one protocol for me to fully get that relief. And I hadn't dealt with any, of those symptoms or, subsequent issues since. So that was the first time that I think ANF really blew my mind, was when I got to experience it for myself. And then honestly, every time that I use ANF with someone and I see the results, I feel like a kid just discovering something new again every time. There's never even though I know what I'm doing now, every single time I put it on another client and I see their eyes light up because something has unlocked for them, I get really excited and surprised by the results and the impact that I can make on people's lives. It just from, something that seems so simple but has so much beautiful complexity and science to it.
What did you learn through ANF Academy that you didn't learn anywhere else? I guess after graduation, maybe you took some different courses before you encountered ANF.
Yeah, some of the biggest things, and it's one thing that I end up educating every single one of my clients with the day that I meet them and I explain what's going on, is the hierarchy of dysfunctions of the body, seeing how everything lines up, where the emotions are, the most important thing that the body sends resources to, and then you have lymphatic, nervous, cardiovascular, all the way down, and then the very bottom is your muscles and local tissue, which is what we learn in PT school. Right, to understand just how the body prioritizes every system in it and how it will take resources from, the areas that are not so important to be able to support, the higher systems. That was one of the biggest game changers for ANF, because it helped me to realize, okay, if we can figure out which place the body is most concerned about, even though it's trying to help with everything, if we can find the area it's most concerned about, then we're going to make the biggest difference. And there's so many people that I'll just introduce to that component, and they themselves will start to put it together where, they're coming in with shoulder pain.
When it comes to palpation, did they teach palpation at the university for physical therapy?
Yeah, they taught palpation for specifically like understanding the joints of the body and understanding where the muscles attach, but not to the same extent that we do in ANF, where like now
Can you compare it? Can you compare the palpation skills you gained through your university and through ANF Academy?
Yeah, the palpation from university was basic. It was good entry point. With ANF therapy, I feel like my fingers are so much more smart and more wise with differentiating between muscle tissue and nervous tissue and even like blood vessels and whatnot. Like there's actually a difference in the quality of the tissue under my fingers that I can understand. Whereas with, basic university training, you're kind of just like, okay, yeah, I'm pressing on something and I can, I know that that's like in the region of this muscle or joint, and like this is, probably that segment. But yeah, the specificity that we can get with the clinical surgery and ANF to identify much more specifically the different tissues that we're on, that makes it the biggest difference to be able to identify the source of the issue. And so to have that knowledge and deeper anatomy and deeper sense in my fingers, it just like even the patient can tell that I'm on something different, because now I've actually met the tissues instead of just like, feeling
does it take time to refine those skills? I mean, it's one thing to sit and learn about it, but I guess it's another thing you have to practice it over time to have more feelings.
Very much so. Yeah. So that's why my family and my friends are very much used to me saying, hey, can I practice my palpation skills on you? Can I, try? And they're like, okay. I wear a disc on all the time, no matter where I go, just to see who asks me, what's going on your forehead? Are you okay? They'll ask me, what is that? Then they'll read it because, the logo is on it. It says neurofrequency on the devices. And so from that, I'm able to tell them, oh yeah, let me tell you about this. And then I send them, information. And so at least the awareness of that it exists is out there. There's still a lot of people who are like, well, how does it work? And so that becomes like a whole nother, conversation to have to talk with them and try to explain simply, but then also, a lot of people are skeptical.
But how does it feel for a physical therapist to be able to optimize someone's biochemical functions?
Oh, it is one of the greatest. I mean, the reason why I became a physical therapist was to help people feel like they can be free to move again and feel free in their health again. And so to be able to have something where I know I can get them not just to feel a little better, but to actually like be better is one of the most fulfilling things. It goes back to the reason why I got into the field of health and wellness in the first place. It matches right up to the heart and soul of what I'm wanting to do, because I do believe that I was called to be not just someone to learn, but to also to teach and to heal and to serve the individuals that come across and that I encounter during my journey. And so to be able to offer something like that to anyone else, it's one.
Maybe we can, for those that are unfamiliar, maybe we can clarify what does it mean to optimize someone's biochemical functions with ANF.
So as a physical therapist, it lets me do things that affect more of the body far more deeply than I can as a physical therapist. In the physical therapy realm, there's a certain scope of practice that we're able to really influence, and ANF helps that to be much, much greater, much, much deeper, and it allows me to make more of an influence in the field as opposed to if I didn't have ANF, I would be very, very limited with, to what extent I can help optimize the body, because I'm just working on the movement from a muscles and joints and, some of the basic cardiovascular aerobic endurance type stuff. But with ANF, we actually, again, get to the start processes of how does the body get to optimize its neurological frequencies, and that makes the work that much more impactful and deeper than the scope of just muscles and joints.
What is the end result with ANF? So when a patient has completed all the treatment, what does it mean? It's not going to have pain for some time, or the issue is completely resolved, or how does it look like for a patient?
So with the patient, for example, a lot of the meniscal injuries I see are coming in from pickleball, right? That's a very common injury. The individuals that I've treated, their meniscal issue with ANF, they have come back and they have not dealt with that issue again after the fact. Sometimes they'll kind of feel the twinge and the awareness, but it's not the pain anymore. It's their body giving them a warning signal as opposed to the debilitating pain. They have to stop. And so it resolves the root issue for them and helps their body to be able to feel safe enough to play pickleball again, as opposed to someone who I've seen with the traditional therapy model. There still usually is quite a bit of tentative awareness and distress whenever because they're afraid that it's going to happen again.
Okay, thank you. And for the end, it's something I like to ask everyone. Is there something like a message or something you would like to say to those that are medical professionals, that this is the first time they hear about ANF therapy, or they may heard about it before, but they didn't enroll in education yet?
So if you're considering ANF therapy, or you are really looking for something to literally 2 times or just like exponentially increase your impact and actually achieve recovery and empowering your patients or your clients, ANF is absolutely what you need to have in your toolbox, because it is so simple, because it is so accessible, because it is a continuous learning opportunity, and you're networked with so many other incredible professionals that you're never on your own. I'm constantly in conversation with, mentors to make sure that I am giving the absolute best protocol of the devices to my clients, and to have that sort of community, that sort of guidance, and then just our own personal skills that you can tie in. It's the future of medicine. Really, truly, it's what's going to make the difference and help people actually get out of pain, get out of their sickness, and be able to live a life that's healthy and well and empowered.
Thank you, Sarah. This was quite interesting.
Yeah, thank you so much, Saya.